Show, and today is Monday. And today I want to thank our friend Barbara for getting us an amazing interview with Dr. Robert Young from the pH Miracle. He's the author of the pH Miracle and phmiracleliving.com. Today he's going to be talking about how to measure your body's pH and why it's so important to keep it at a certain level. Go ahead and take a look. How do you know, what's the best way to test your own pH?
Well, it's very simple and it's inexpensive, and it's something you should do on a daily basis. You can use pH hydrant paper. It's treated paper that picks up the chemicals within your urine or your saliva. It interacts on that paper, that litmus paper, and changes color. And depending on the change of color, determines then, of course, the pH, and it can go in increments of 0.5 units. Mm-hmm. So I can go from, on a scale of 0 to 14, it starts at 5.5 and going in 0.5 units, and go from 5.5 to 6 and up. But every change of 1 point, okay, is a tenfold increase or decrease depending on which way you're going up and down the scale. So our blood will always maintain its integrity at 7.365 until you die. And you know you're dying if your pH goes up because the body's pulling alkalinity into the blood to preserve its integrity. And then when all those alkaline reserves are being used up, the pH shifts and it starts dropping below that 7.365, and you know you're on your way out. So when you see blood pH going up from 7.365 to 7.4 and to 7.5, you know you're in what is called latent tissue acidosis. Mm. Okay, and latent tissue acidosis means delayed acidosis that will express itself very shortly in some symptomology that you're not going to like. Okay, and when you start feeling the pain of latent tissue acidosis, you're going to go to the doctor and they're going to diagnose you with a health condition that's going to require treatment that you probably won't survive. When you're in decompensated acidosis, okay, where the pH of the blood goes from 7.365 down, then you don't have any reserves left, and so therefore, the body is dying. I'm melting, like the Wicked Witch in The Wizard of Oz says. Dorothy threw water on it. I'm melting, and that's people are melting. They're actually deteriorating from the inside out. So if we're testing the urine, that's the blood. If we're testing the urine, which is a lot easier to test, yeah, okay, because I'm not suggesting you prick your finger and put the pH hydrant paper. It's not designed for that. Right. Okay.
It'll turn out red.
Okay, right. Well, it doesn't turn the colors that we want. It doesn't interact with the chemicals. Mm-hmm. But there are instruments to test. They're very delicate and they're also very expensive at the same time to test pH, but you don't have to test the pH of the blood. You can test the pH of the urine. And the urine pH should be 7.2 or greater. Now, ideally, if you're in a state of homeostasis, which means alkaline balance, the pH should be right around 7.2. It may vary a couple of points, but there's a lot of wide swings in pH of urine.
In the morning? When is the testing?
Well, traditional medical, the parameters go from anywhere from 5.5 up to 8.5, and so they don't. I like to keep it in a narrow range, right? Like, 7 to 7.2, 7.4. I like to keep it in a narrow range.
But you test in the morning?
So what you do is you test your urine first thing in the morning, and you test your second urine. Mm-hmm. The urine, your first urine pH test is a reflection of how you lived your life the last 24 hours. Mm. So if you went out, and just partied hardy and drank too much, ate too much food, and you don't have the alkaline reserves that your body needs, you're going to be right in the cellar. Mm. Okay, your pH is going to be in the 5s. If you party hardy and you're young and you've got a lot of alkaline reserve, it's going to be off the scale. It's going to be over 8.5. It's going to be in a state of alkalosis. Mm. Okay, because the body's trying to pull alkalinity into the tissues in order to neutralize the acid. But if your body is removing a lot of that toxicity, then, especially if you're dealing with a serious illness, you'll see that the pH drops until you can reestablish the alkaline reserves. But the pH of the urine is a direct indicator of tissue pH for the last 24 hours. And if you are consciously attempting to increase alkalinity, then what you'll end up seeing is the pH gradually increase as you continue to alkalize. And the tissues can withstand a pH of 8.5, 9.5, 10.5, even up into 11s.
Wow.
Okay? But the tissues cannot withstand a pH in the 6s and the 5s. It'll start breaking down. In fact, cancerous tissue begins at a pH of 5.5.
Okay.
So you have to watch these numbers.
5.5 in blood.
Urine. In urine.
Okay. Okay.
So if your tissues are continually if your pHs are continually in the 5s, then this is a cause for concern. Now the second urine should go up.
Right.
Okay. If it doesn't, then you know you're alkaline deficient. And if you stay within those parameters where your pH is down in the 6s or even the 5s, this is an alarming situation. You are in latent tissue acidosis and need to start shifting that pH through an alkaline lifestyle and diet. There are ebbs and tides. Your pH should be at its highest at 2 p.m. in the afternoon. It should be at the lowest at 2 a.m. in the morning. So that's why a lot of people have to get up at night and eliminate, because the acidity is so great. The urgency to eliminate that wakes you up. You're in the bathroom, and that's why so many that have serious degenerative conditions urinate, have to get up maybe 2 or 3 times a night. That's an indication of latent tissue acidosis. You test the urine, you'll see that the pH is in the cellar. It's in the 5s. So you want to shift the pH of the urine not from 5.5 to 8.5. You want to shift the pH of the urine from 7.2, 7.5 up to 8.5 or 9.5. You want to move up that alkalinity and constantly be throwing out alkalinity, because the blood cannot stand high levels of alkalinity, nor will it withstand high levels of acidity. So if your diet and lifestyle is acidic, it'll push acid out into the tissues. If it's highly alkaline, it'll push alkalinity out in the tissues. And that's exactly what we want to do. And that's what the protocol that I recommend focuses on, is to hyperalkalize the tissues,
right,
to neutralize the tissue acidosis that causes disease. Alkalinity does not cause any disease. All symptomologies of acidosis and alkalosis are a result of acidosis. Now that sounds like I'm speaking out of both sides of my mouth. But when we're looking at the pH, okay, of the blood, and the blood pH goes up, it means the tissue pH is going down. Well, when we're testing the blood and the blood is going into a state of alkalosis, that means latent tissue acidosis. And on the reverse of that, if the pH comes down, it still means tissue acidosis. That's why I say what I'm saying. There's no such condition that provides unhealthful symptomologies as a state of alkalosis. There's nothing wrong with hyperalkalosis if you're forcing the alkalinity on purpose and the pH is within that normal range, the blood pH is in that normal range between 7.365 to 7.4.
Your question of the day is this. Tell us what your experience has been with the pH Miracle. Go ahead and post it down below. This is Kevin Gianni from the Renegade Health Show. Together we can change the health of the world, one show at a time.